everybody, it's Dr. Tim and Kaylee. We are here to talk to you about Epic Tea. And I want to talk about TRT and HRT. These are big trends happening. And whenever you give the body something it produces like testosterone or estrogen, the brain says, I have enough of that thing, and it stops producing it. That being said, if you are on TRT or HRT, this is a necessity at this point because with those hormones you're giving the body, I don't care if it's synthetic or bioidentical, there's side effects. If I increase your testosterone through TRT, you have a chance, a likelihood that some of that testosterone is going to convert to some of the ugly things that contribute to heart attack, stroke, cancers. We do not want testosterone to convert to DHT, dihydrotestosterone. This is bad, okay? This is what the prostate drugs, the hair loss drugs for men are for. This is why PCOS happens in a female. We don't want testosterone to convert to DHT. That's bad. Okay. This has an inhibitor. We have a clinical study showing this inhibits that conversion, which is really cool. So if you are on TRT, you at least need to take something like this to mitigate the side effects of that maybe irresponsible decision. I'm not going to tell you to get off the TRT, right? But there's side effects that you have to understand that come along with that choice. Another thing that happens with TRT is testosterone also converts to estrogen, right? Okay. Men might think of, the man boobs, things like that. That is not good. That's too much estrogen conversion. This also, we have clinical studies showing this inhibits testosterone to estrogen conversion, which is good, right? If you're going to do TRT, it's very important to mitigate the side effects so that you don't have scary things happen eventually by having too much testosterone converting to things that are kind of dangerous in the body over time. So,
does this react or activate the same in males and females regardless of their existing chemistry?
Great question. So if we have DHT, for example, testosterone converts to DHT in men and women. Okay. In women, that might happen to cause PCOS. Those are the things that can happen when you have too much DHT being converted in a female. In a man, it also happens. But in a man, you might notice the male pattern baldness, prostate issues. We don't want too much DHT converted in a man or woman. So this is going to help mitigate inhibiting that conversion from happening.
Is it possible that if it's inhibiting this, that it can inhibit it too much and that there's another side effect that results from that?
You can't really get too much of that because this is plant-based. You can't really take away too much DHT, right? We don't want a lot of that to convert. So this is plant-based, it's safe. The cool thing with nutrition is it's only going to use what it needs in the body and not force a change to the body. This is not a medication. If it's available, it's gonna help, but if it's not gonna do anything. So I take a lot more of this than most people because I know how safe it is. And if there's extra help that needs to be done, I know that I'm gonna do that by taking a higher dose. Minimum, we want people to take one a day to inhibit the estrogen conversion, inhibit the DHT conversion, and mitigate those side effects of TRT or HRT.
So, question, if there is not an issue with too much estrogen or too much TRT, then is this still good for someone who is well balanced already?
Absolutely. So cancer, as we know, is the number 2 killer, just below heart disease. So we want to do everything in our environment to lessen the chances that might happen sooner than later, right? So we know that it's dangerous and contributes to cancer if we have too much conversion of testosterone to estrogen or to DHT. So all the help we can get, just like eating healthy, exercising, there's no one thing that fixes and mitigates everything. So it's a combination. This is another tool through clinical studies that we've proven to affect, those bad things from being converted over time. So let's talk about how furosemide and spirosemide work in the body. That's the bioactive in the Fenugreek extract. Those are the chemical names, okay? So let's talk about how this affects testosterone levels. We all produce a certain amount of testosterone. There's 2 really big releases throughout the day. In the morning between 6 and 8 a.m.
For males and females.
Males and females. Between 6 and 8 a.m. and then in the afternoon, okay? So I'm just going to use theoretical numbers. If I release 100 in the morning, but I lose 80 of it to an irreversible bond called SHBG, now I have 20 left. I might wake up tired, foggy brain, hit that early afternoon crash. That's not good. So most people are not having enough free testosterone in their body. So imagine a drug, let's say a drug first, that would actually compete with those irreversible bonds, I take it the night before I go to bed. It binds to those receptors. When I release my 100 of testosterone in the morning, now I have 100 to utilize on my own.
Okay.
That's pretty cool. So I'm making my own testosterone levels more efficient without the side effects of some of the other things that are traditional. All you're doing is, and it doesn't matter if you have 100 as your testosterone or 1,000, it's just converting, it's giving me more free testosterone, which most people have about 2 to 3%. If I just increase that by 0.5%, that's a game changer. You will be a different person. Your energy will be different. So the goal is just to get more bioavailable, more free in the blood, not necessarily to have a really high testosterone number, to have more of it accessible. And that happens by taking something like this. It's going to bind to that irreversible bond. When I produce my release now, I'm going to have most of it to utilize. So energy goes up. I can build muscle better. My bone density gets better. I can sleep better. It's optimizing, not giving your body testosterone. We know that there's side effects that come along with that.
Okay, so it's more of a holistic enhancement. It's not just focused on one hormone, one active thing, one result.
Absolutely.
This is a holistic approach to how your body functions and how everything is working biochemically together.
Absolutely.
Right? Okay.
Rarely we want to give the body something it's low in.
Yes.
It's not that simple.
Yeah.
And we don't want to just take away forcefully something you're high in. We want to balance things. We want the body to figure it out. So by doing this, not providing the body testosterone, by letting it work itself out, essentially, it's more effective without the side effects.
Okay. Awesome. So what is the difference between this one and then regular testosterone or synthetic testosterone that people are taking on a daily?
When you give the body a hormone, whether it's testosterone, estrogen, progesterone, DHEA, even melatonin, even hydrochloric acid, which is stomach acid, which is the most digestive products out there, right? Anything your body manufactures and you give it to the body because it's low, it was already having a problem being created in the body. That's why it's low to begin with. You've had an issue for developing for years, typically, to that point. And now I'm just giving it to the body. So it's not uncommon to put you on testosterone or melatonin. You're going to feel better. Absolutely. But now your brain has a signal that says, I have enough in the body. Those organs that used to produce it shut down now. It's use it or lose it.
Yeah.
That's why rarely you want to provide something to the body that it should be producing. We want to get the body healing, the organs stronger, utilizing what it has better and more efficiently, not just force a change with synthetic or even bioidentical hormones. So one of the cool effects of Epic Tea is we know through clinical studies, it inhibits conversion of testosterone to dihydrotestosterone, DHT we'll call it.
Okay.
That's a bad thing. If we have too much of that, it contributes to prostate issues in men, male pattern baldness, other issues. In females, too much DHT conversion contributes to PCOS and other hormone imbalances.
Got it.
This is clinically proven to inhibit converting testosterone to DHT. There's in fact a whole category of drugs that are designed for that one thing. Finasteride, all these other drugs. If you've ever seen a commercial for male pattern baldness, a medication for it, or prostate drugs, that's what the goal is. It's to inhibit testosterone from converting to dihydrotestosterone. This is clinically proven to do that, to essentially replace what that drug category is trying to do. But this does so much more than that. We'll use that little chunk and then,
So,
we're videotaping. Come on, man. Let's talk about estrogen and Epic Tea now.
Yes. Estrogen dominance is a huge hot topic right now for females, including myself, because it is just now coming to light to a lot of people that we are suffering from this. And this is why our menstrual cycle and a lot of other things are out of whack because of this. So explain what estrogen dominance is and how does this help?
Well, that's quite interesting. A lot of what we do is changing how people are thinking about this stuff, right? Birth control is estrogen. Do you think that taking birth control would create estrogen dominance? Well, of course. The problem is there's xenoestrogens in our environment. There's estrogen in tap water, most municipal waters. It's in foods, it's in chemicals. There's so many hormone disruptors now that we all need to be concerned that we're probably getting more estrogen than we should. That's called estrogen dominance. That doesn't mean you have crazy high estrogen levels. It means that you have maybe normal estrogen, but a very low progesterone compared to. It's just a hormone imbalance. But again, we don't want to force the low things.
The ratio.
Exactly, the balance of the ratio.
Right.
So we don't want to force the low things high and the high things low. That doesn't fix the cause. So this has been clinically proven to actually inhibit one of those variables, which is testosterone converting to estrogen in my body. It's called aromatase. This is an aromatase inhibitor. We have clinical studies showing that it prevents that from happening. That's a big deal. there's a whole category of drugs that are aromatase inhibitors.
Mm-hmm.
A lot of women have heard of them, the tamoxifens. These are drugs that are commonly recommended after breast cancer or surgeries because they want to do that one thing, stop testosterone from converting to estrogen. That is the sole purpose of that whole category of drugs.
Right.
But it's a drug, it has side effects. So if we can
Right.
do that with a plant-based supplement, if we can keep testosterone from converting to a bunch of estrogen, how cool would that be?
Yeah. And if your body can naturally and re-enable, is that the way that we would describe how this works? Is it's going to enable your body to naturally do these things on its own? Or is this something we have to take long term, or that we should take long term?
So estrogen dominance, there's so many variables as we talked about.
Yeah.
So every little thing that we can do to balance that out is great. Exercising will actually affect that.
Right.
Eating certain foods will affect that. This is just a more therapeutic, easy way
Okay.
to keep that from happening. I don't want the testosterone to convert to estrogen, but a lot of things in our lifestyle will help that. This is another tool to allow that.
Okay. So on a micro level, this is doing a lot of different functionalities in the body, depending on what your body needs and how it needs to function,
Absolutely.
male or female. But overall, it's safe for anyone, male or female, to be taking because it's only going to do what's necessary. Is that accurate to say?
Absolutely. And my obsession, my purpose in life
Yes.
is to find the most powerful nutritional therapies to affect labs. I love evidence. I
Yes.
love diagnostics.
Get
So
your labs done.
instead of having categories of drugs that change these things, what
Yes.
about a safe, non-invasive way without the side effects to do these things that we would usually require medication for?
Yes.
That's my obsession. So we know that this absolutely affects, different hormone levels. We have the clinical studies showing that it absolutely helps balance your testosterone levels. It's going to help give you more free testosterone, which is what gives us our energy and our brain function. So whether you're male or female, we all need testosterone, a bioavailable amount,
Yeah.
because it determines if you're happy, sad, depressed, if you can put on muscle or bone density, and
So-
otherwise.
I'm glad you said that, because the natural inclination that we have, or what we've been conditioned to understand as females, is testosterone is a very male-dominated hormone for males, made by males only. So I don't even know if many females understand that we also have it and make it and need it. So tell us, what does testosterone do for a woman, and what does it not do? What are some of the myths out there, like
Sure.
extra muscle? So when you're talking about all this free testosterone running around in our body, it can sound very scary. Like I don't want to grow anything I'm not supposed to be growing, or get extra buff, or start to have facial hair, etc. So what does it actually do?
So a lot of misconceptions.
Yeah.
Testosterone is as important in a female as it is a male.
Okay.
We just have different ratios. But
Okay.
if yours is low from normal, you will have foggy brain. You will have trouble
Got it.
keeping muscle on. You will have bone density issues over time. And
Yeah.
other hormones will be out of balance as well. So yes, testosterone has a bad name. It seems masculine.
Mhm.
Well, it's not. If you increase your testosterone with synthetics, then you're going to have those masculine features, right? Maybe we're
Okay.
picturing a female bodybuilder that's using synthetic steroids.
Right.
They do look masculine. They're forcing that change to happen. But everything you're already doing in your environment is affecting your testosterone levels already. When you exercise, it creates a healthier balance. This is just another tool to help get you in that healthier balance, but it's just as important for females.
Okay.
You will have osteoporosis eventually if you have low testosterone. You will be more prone to depression. It is the driver. It is an androgen, which sounds
Yeah.
scary to people. That's not scary. When you exercise, you increase your testosterone. This is just another way to get access to your free testosterone, so you feel better.
Yeah, and I can attest to that, because since I have been taking this for the last 2 months, overall my clarity, foggy brain has disappeared. Like, clarity is better. I feel more sharp. I feel more enhanced, and it's a balance within me. It's not just one thing. It's not like I'm just going to the gym and feel stronger. Like, this is an overall holistic approach of just feeling enhanced and balanced. So
Absolutely.
I can definitely attest that. And energy levels, that's huge. The energy levels have significantly increased for me, and I was feeling really lethargic and just out of whack, completely imbalanced and not myself for the past 2 years. And this has really, really helped. So I'm grateful for it, and I can attest to that, at least.
As you know, this does so many different things, mechanisms in the body, plant-based, safe. One of those things is this is also a PDE5 inhibitor.
Okay.
PDE5.
PDE5.
You may
Okay.
not have heard that term before, but
No.
this is what the male and female Viagras are designed to do. Those are
Gotcha.
PDE5 inhibitors. So we all know the effect of that when people take those things, right?
Yeah.
It's a big problem. People don't want to talk about this problem. It's kind of embarrassing. It's a bigger problem than you realize because these sections at the nutritional stores are very busy. It's $1 billion industry. It's a very big problem. So instead of taking a drug with side effects, what are other PDE5 inhibitors? Well, there's certain foods that do that, right? This is a bioavailable extract. This is also a PDE5 inhibitor. We have the clinical studies showing this absolutely does that. So am I willing to take this over something with side effects? Of course, every day of the week. That's one of the benefits, as well as the other inhibitors of some of the negative things that come with hormones.
Okay.
So who should take Epic Tea? Well, this is a male and female product. This is a hormone optimizer. It's plant-based, right? It's bioactive, safe, comes from nature, right?
Okay.
So men and women need this. Now, most men, I have take 1 before lunch and 2 at bedtime. They'll get the benefit of all 5 mechanisms of this if they do that.
Okay.
Women, I have them do 1 before lunch and 1 at bedtime. So just a little bit less, but if you took more, it's not harmful. That's the cool thing about it.
Yeah.
You're not going to force a change on the body
Good.
with nutrition. You will with medications. We have to get rid of this medication mindset.
Yeah.
This is not medication. It's
Yeah.
the safe way to do these things.